Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment.
Nobody knows. What should I bring, right? Now, here's the thing. Other than what to bring, what is it that you should not bring? And what is it that really actually works, okay? So when you're going into these places, well, you should have your brochure, okay? You need to be able to have your brochures. That's important. You need to be able to have those folders, right? Now, I've seen sometimes when you go to Office Depot, Office Max, they have these cheap, glossy folders, and it's like 25 cents, 35 cents sometimes. If you invest a little bit more money, you're able to purchase some real nice custom folders that has your logo in it. Now, I've seen some people pay some money for some folders to be made just to put their logo in it. No, you have to be able to take advantage of the whole real estate. Have some photos in there that are nice, right? That's representing your company. Let people know when they see that folder what is going to be in that folder as much as possible, okay? And then some people, there's a business card slot when you open up the folder. I suggest this is on that sleeve. Make sure you have your company's information in there even without the business cards. You don't need to put a business card in there. The reason for that is you want it to be easily accessible and for them to see who they need to contact. That is such an important thing when you're using actually some of these techniques. Now, what should you not bring? Well, we'll discuss this later on, talking about lunch and learns, since I don't believe in lunch and learns and feeding these people. We'll talk about that later on. So you should not bring heavy amounts of food to feed them. No. This is the first time you're walking in, right? You need to be able to court them. You don't want to be able to try to spoil them right away and then all of a sudden they have that mentality. You're going to be feeding them so much. It should not work that way. Now, this is one thing that I love to use and gives me a reason to walk in is wacky calendars, right? Wacky holiday calendar. So if you go to google.com and go search wacky holiday calendars, you're going to see a calendar of events of what's going on a daily basis. Like you're going to find out what, National Cookie Day, National Brownie Day, National this, National Milk Day, National Coffee Day, National Donut Day. All these different things are happening, which gives you a reason to be able to walk in. So let's say, for example, it's National Donut Day. I'm going to walk in with some donuts. I'm going to say, hey, it's National Donut Day. I'm here to be able to talk to Tim, who's a social worker. Is he available at this moment? I just want to drop off some stuff for him because it is National, Donut Day, or it's National Cookie Day, or it's National whatever day it is. So wacky holiday calendars is such an amazing thing that gives you a reason to actually walk in. Because people sometimes they say, well, how do I walk in? How do I be able to, pretty much break the ice? Well, that's it. I have cookies. I have a donut. I'm not saying a dozen donuts. You have a donut in a nice container, okay? And so later on, we're going to talk about other amazing things of little tchotchkes that you give away. Because most agencies will come in with the typical stuff, right? What's your typical stuff? A brochure, right? Maybe like a dozen pens and maybe a mug, right? Or a water bottle or one of those large calendars. Guess what, guys? Those are not going to really work as much. Just bring one pen. It's really surprising to me when I see somebody walk in and then they leave like a dozen to 2 dozen pens, thinking that that's going to get them the referral. No, guys, that's a waste of money. If you're paying 50 cents a pen, or even some people pay $1 a pen, and you leave 20 of them, that's $20 that you just wasted for that particular person. Those pens are not going to go to the social worker. That social worker is going to go to the nurse's station and give it away to the nurses. And you just wasted some money because those nurses on the floor are not going to refer patients to you. They're not the ones in charge. They just need your pens. Heck, I'm a nurse. I love pens. And I get those pens a lot, and I will keep them as well. So you have to understand this. You want to keep your cost minimum, but have the right things that makes you stand out. Okay? What's going to make you stand out is the most important thing you can actually do. Now that we know what to expect when we walk in, right? Now we're going to walk in. When we walk in, when we can get past that gatekeeper, right? Because we need to control that gatekeeper, get them the idea that we know the social worker to meet them, right? Now the qualifying begins. This is really the part where qualifying begins. And the qualifying is pretty much the part where you're giving your USP or your unique selling proposition or your elevator pitch, right? These are the parts that you have to be able to gain their attention to be able to have that conversation. Remember, our job in qualifying is to be able to move to the next level and do a presentation. A presentation is where we need to do. In qualifying, we must find out, what made them choose and the current agencies, or what are the agencies they're working with they're doing wrong.
Brought to you by our partners at HomeCareAnsweringService.com and MedicationReminderProgram.com. So MedicationReminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, HomeCareAnsweringService.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have HomeCareAnsweringService.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time, at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.